In his second chapter, Morley Glicken takes a look at the history of the social work profession, where its earliest roots are, and how it's developed over, particularly over the last 100 years or so, much more in depth. If you've ever taken Social Work 106 with me, this is really a very thumbnail sketch of that history that we go through when I teach the introduction to social welfare. That is a social work course, Social Work 106, and at some point if you're pursuing a social work degree here, you're going to take that class. It's available both on campus and online. So this will just give you a little bit of a overview of how the profession has developed. Really, we reach back into the days of the English Poor Laws to understand where our attitudes and beliefs and values come from, and back into England in the 1600s. The problem in the mid part of the last century was the breakup of the feudal estates, and the individuals the serfs who lived on these feudal estates and depended upon lords and masters in the castles nearby. And as that system fell apart, really with the introduction of capitalism to Europe and around the time of the Protestant Reformation, a cash-based economy developed, and the feudal system really passed by the wayside and was no longer useful. The individuals who lived on these small farms were more or less released into the general population and moved from community to community and became something of a burden to those individuals who lived in those communities, because there wasn't work for them and any way for them to earn money in order to make their way. So in England, the Parliament and the governing agencies developed a system of expectations in terms that spelled out who was responsible for these poor persons, what responsibility did the community have to them, and what responsibility did private individuals have for themselves or family members have for their own members. And out of the English Poor Laws, in fact, the current system, which really places a lot of emphasis upon first individual responsibility, but then next family taking responsibility for needy individuals, really develops out of the English Poor Laws. The notion that the government is the last agent of resort in helping poor people develops from this system. These laws were passed over a 400-year period and changed. Really, when they talk about the 400-year period, we're really talking about starting in 1600, and it's in increments has changed the way we think about poverty and our work. There was a new English poor law in 1834 that was a set of laws that were established in 1834, and one of the big differences there was that they differentiated between the deserving and the undeserving poor, or the worthy and the unworthy poor. And this is a concept I want to mention to you. Those of you who've had 106 with me are familiar with this, but something that doesn't always seem to get through to people is that the concept of the deserving and undeserving poor, or the worthy and unworthy poor, are not concepts that social workers adopt. These are the popular conceptions of poor. For instance, the deserving poor would be perhaps widows and children and disabled individuals and maybe veterans who are having difficulties because the society owes them something. Generally, the individuals who seem to be able-bodied and able to work but aren't working, women on welfare, for instance, single males who aren't working and who have no noticeable disability, those on unemployment sometimes are considered undeserving. This is a distinction that the general population makes, and that these English poor laws and other programs have set up, but really aren't acceptable attitudes that social workers would have about individuals who are in need. So that's just something to clarify for you. This is something that other people do, but that we really don't in our profession. As a group, we don't see our clients in this way. In the mid 1800s, workhouses were established to deal with the undeserving poor in particular, to kind of teach people how to work and to stimulate this work ethic. And the conditions in these workhouses, although they were supposed to provide food and clothing and all the basic needs for individuals, were really pretty reprehensible. For a long time, children were put in these workhouses along with other individuals, but the separate notion of social work with children and child welfare started developing in the mid 1800s. In fact, because of the fact that it was seen that children needed to be treated separately, because these workhouses, or almshouses as they were otherwise called, were just no place for kids. And so what you had happening there was children being taken away from parents who were in these workhouses and almshouses because these parents weren't taking care of themselves. And this notion that of unfit parents, in fact, began to develop during this period of time, that if somebody wasn't able to provide for their family, they shouldn't have children. And that was enough justification to really have children separated from their parents in the 1800s. So that if mothers were unable to support themselves and their children, they might go into this workhouse, and as I said, then maybe be separated from the children. But the interesting thing was that the fathers were generally considered to be free of responsibility for any illegitimate children that they had. And this is an attitude that while we do have the child support enforcement units in most states that place an emphasis on fathers being responsible financially for their children. The attitude, the idea, basically, socially speaking, is that mothers are the ones who are responsible for their kids, and fathers kind of get a free ticket away. We talk about deadbeat dads not supporting their kids, but really there you're talking about economics. You're not really talking about being there to raise your children, and mothers are the ones who, in our culture and in our society, are the ones who are in large part considered to be responsible for the children, and fathers kind of get a free pass. And this reaches back into these kinds of systems that were established, a couple hundred years back. So then again, this slide talks about the horrific conditions in the workhouses, and so a movement was really developed during this period, during the 1800s, then, that looking at different ways to deal with the needy and the poor, rather than putting them in these workhouses and that type of thing. And so well, in Britain, it says here that some of the programs that were established during that period of time became a model for programs that were implemented during Roosevelt's New Deal in the 1900s in America. But by the early 1800s, in this country, the states had begun providing relief through towns and counties. The idea, if government was going to provide for needy people, if individuals couldn't take care of themselves, and families couldn't take care of themselves, and institutions weren't going to be able to solve the problem, then if government was going to have to intervene, it was going to be local government first, and really the federal government, really through the middle of the 1800s, it was really kind of after the Civil War when the federal government began to be associated with social welfare programs. Until that time, the federal government stayed out of social welfare altogether. There was a lot of emphasis placed on private benevolent societies and self-help organizations during this period of time, and these became sort of the early forerunners of the social welfare movement and social service agencies that we have around us today. And this particular comment is, I think, a little out of the really misplaced in this slide, but it talks about compassionate conservatism, and that's a political term that George W. Bush, young George Bush, used during his campaign for the presidency, coming out of the Clinton administration after 8 years of Clinton and welfare reform and that kind of thing. Bush campaigned on this notion somehow that, yes, I'm a conservative, but we have compassion and will provide for those who really can't take care of themselves, but there are certain things that need to go along with this. And as this slide points out, the brand of compassion that the Bush administration pushed forward with really was tied very closely to the teaching of moral values and really strict conservative moral values. And those values really still characterize a lot of our public assistance programs today. Following the Civil War, there was a recognition of serious social problems. Slaves moved from a condition of what were referred to as we could call chattel slavery, where they're chattel being property, into, well, they really slaves in many respects were kind of released into society without any preparation at all, and I have read and heard many different times that the condition of those who were enslaved and then emancipated were much worse for quite some period of time after their freedom was granted them than they were under the slave institutions. At least during that period of time, somebody took some responsibility for taking care of them. But when they were kind of turned out on their own without proper education and training and experience and people willing to hire them, in fact, slavery really took on a kind of another type of problem with that. So there were very serious social problems following the Civil War, and at the same time, the Darwinian theory in the late 1800s, I think, was developing, and the notion of the survival of the fittest. And really science in general was developing. So science, this interest in science, could pin down particular causes and effects of certain kinds of things, and individuals wanted to apply the scientific method to understanding human beings. And so the Darwinian notions of the survival of the fittest, that only the strong survive, and that those that do survive strengthen the species, those that are weak die out, and in doing so also strengthen the species because their genes are no longer in the pool, so to speak. That's what we call social Darwinism, and that social Darwinism rested under the concept of scientific charity. That is, using concepts common to business and industry and science to cope with the larger social problems in our nation. Here are some references to some early organizations. These are private organizations that developed to try to address some of the social welfare problems of the late 1800s or the second half of the 1800s, and the American Charity Organization being one of the first for the scientific charities. And there was an attempt there to help people with severe social problems in an organized and logical way. But so many of these, I've also heard them referred to as AICPs. Also, the name, the words behind the letters are escaping me right now. But it's essentially the same kind of concept. And so there were so many of these voluntary organizations getting established during this period of time that they were duplicating services, and so the charity organization societies were kind of developed to kind of oversee and monitor all of these different kinds of things. There was also some concerns about graft and corruption during this period of time. And so the COS were developed to kind of monitor all of these and organize all of these charitable organizations, and also began to put a focus upon trying to find a way to change things so that poverty was no longer a problem. And the focus that the COS has adopted was on changing the individual, not on changing the system, not on changing the larger society and all of those things that were contributing to poverty, but really focusing upon the individual. Individual blame, with the exceptions of a few periods of time in American history, is how we see poverty. We believe poverty as the result of an individual being lazy or not following through with with their responsibilities. And so the COSs were really, again, kind of an early forerunner of the social work profession. Not only did they work to provide aid on an individual basis through the casework method, but they also began to do some studies of the individuals that they were providing assistance to. And the interesting thing is although they were very much focused upon individual blame and poverty, the results of their studies demonstrated that, in fact, there were systemic reasons for poverty. Another movement that developed and had a different kind of focus was the settlement house movement in 1886. Jane Addams, and who had been a young woman who had been in England and was exposed to this method in England, brought it back to Chicago, and Hull House, which is still stands in Chicago, was thought to be the first settlement house, or the most famous settlement house of the late 1800s in America. And rather than focusing upon changing the individual, the settlement house movement focuses on the causes of poverty, the larger systemic issues of poverty, and how to go about changing that so that more jobs could be available for the poor. It also focused upon education and recreation, particularly among immigrants, to help them learn the language and organize and understand our system so that they were better able to advocate for themselves. This movement really kind of focused upon the strengths of individuals, which is one of those things that the social work profession focuses upon today. Rather than seeing them as deficient, the settlement house movement saw the strengths that were there and tried to organize society around that so that the individual could take care of themselves more efficiently. Additionally, they also conducted a lot of research in that movement, and you can see a variety of different programs, including widows' pensions and legislation that eliminated child welfare and instituted public health reforms. Those kinds of things all kind of grew out of the settlement house movement. So rather than the micro change, that is individual change, that the COSs focused upon, the settlement house focused upon macro system change, that is reflecting change on the level of the structure of society on the community, state, and national level. In 106, we spend some time looking at the progressive era, and these slides kind of skip right past that, but the settlement house movement and the COS has actually contributed to change in the system. There were a series of economic depressions and crises throughout the late 1800s. Teddy Roosevelt, when he became president in the early 1900s, recognized the vast disparity between the wealthy and the poor that existed in those days, and went about trying to break up some of the large corporations that seemed to be taking advantage of workers. I can spend and do spend a whole semester talking about these issues in 106, and I'm going to have to skip past this for the purposes of this particular lecture, although we may come back to it when we look at poverty in another few weeks. But suffice to say that the progressive era instituted a lot of reforms that focused upon the individual and the benefiting the individual, and kind of getting the government involved in managing business so that individual workers and individual families weren't harmed by the vast wealth that was accumulating at that time. It's not entirely unlike things today, and what the Occupy movements have brought to our attention most recently about the 1%. The 1% existed 100 years ago as well, and probably will continue to exist as long as capitalism is our system in the United States. But in 1929, the stock market crashed. People lost their jobs and lost their life savings. Businesses closed. Individuals who had been wealthy and successful suddenly had nothing. And lo and behold, these are some of the people that are in charge and running our society. And suddenly they recognize that poverty isn't just about the individual. Poverty can have a systemic cause. And so as a nation, we become more interested in instituting changes to the social and economic structure that will take care of people in times of need. And so Franklin Roosevelt, elected in 1933, introduced the New Deal and its various programs. I believe we're going to look at this again a little later on when we go in some of the later chapters. But really, the New Deal was a large system of set up for social and economic recovery. The big difference here is the federal government was used as the instrument of change. The federal government became the broker for the individual with the world of business, and with owners and those who were wealthy, and so a lot of programs are put in place that not only helped them deal with, for instance, unions were given more rights, collective bargaining rights, and those kinds of things, and the 40-hour work week was implemented. Workers' comp was really kind of developed, although that was a state program. Unemployment compensation, those kinds of things. There were programs put in place to assist workers. At the same time, a safety net was put in place for a lot of other people, like retirees and single women with children. At the time that the New Deal was implemented in the Social Security Act, which is the most important program probably that came out of that, was implemented, the notion was is that women with children should stay home with them and raise them, that it was healthy for them to be there. Some of that kind of ties into our notion of what the role of women was in those days, and the belief that women were responsible for raising the next generation. And so some could see this as a sort of a sexist kind of approach, but the idea was nonetheless that women should be able to stay home to take care of their kids, and that's where the public assistance program developed. It was then called AFDC. So the idea was is that greater government intervention, greater government regulation would solve a lot of the problems. And poverty was now seen as the result of economic, that is systemic problems rather than personal fault. And so the Depression helped to define the government's role in helping people whose economic situation has become troubled. Continues to be the source of great debate today. And the ideas that developed in the middle of the 1900s with the New Deal are always challenged by our leaders today. And many of the programs that were implemented during the New Deal have been modified and dismantled in so many respects. George W. Bush has even had attempted to more or less privatized the Social Security system 10 or 15 years ago. Well, 10 or 15 years back, but wasn't successful at doing that. But again, another rather large, long discussion about that we just don't have time for in this course. The Social Security Act of 1935 gave recipients a social welfare net that provided for things like retirement income and protection against catastrophic economic problems. But the New Deal took public relief, assistance provided by the government, took that beyond simple provision of helping the poor, but really it included things like regulating and improving housing, establishing electricity in areas where in those days, like Tennessee Valley Authority, for instance, where there wasn't electricity, putting in roads and dams and things like this. Really, all of this intended to lift the economic well-being of individuals in those areas. Child welfare programs, health programs were put in place, and so these series of programs really were intended to protect all Americans in times of serious social and economic upheavals. And in fact, when you look at some of the including the most recent economic problems of the 2007-2008, while individuals lost a lot of money during that period of time, and there were serious economic problems, and there are those who say that really our economic system was on the verge of collapse just in the latter years of the Bush administration, at the end of the Bush administration. Nonetheless, the system pulled through, and individuals pulled through, and one of the reasons for that is because of the programs that were established under the New Deal. And the Great Depression in 1929 in many respects was so much worse, relatively speaking, because those programs weren't in place before then. With all of these programs being put in place, of course, the social work profession grows, and there are more and more roles for social workers in all of these programs. And you see here that says that the number of workers doubled to 80,000 within a decade during this period of time. During World War II, there were a lot of war-related assignments and work for social workers as well. But the social work profession really began to develop a set of professional practices and objectives with an attempt to kind of standardize our belief systems and our values and education as well. And so two organizations that really developed during this period of time include the Council on Social Work Education, CSWE. And the CSWE really oversees social work education in the universities all across the nation. UAA is a CSWE approved school of social work, and any school of social work that you were to apply to or to associate with, you would want to make sure that the Council of Social Work Education approves their program. There's a certain basic standards that for social work education that the CSWE dictates to schools, and so when you hire a social worker, you really pretty much what you're getting because of that. Also, the National Association of Social Workers, developed in 1955 and continues today, and among other things has a code of ethics that all social workers that belong to NASW subscribe to, and really all social workers should subscribe to. And we'll be looking at that code of ethics next week. In the 1960s, poverty was increasing once again and kind of being rediscovered. There's been a lot of focus upon poverty in the cities, and one of the reasons, frankly, I think from my reading of history, that some of the leaders had turned their attention to poverty in rural America, which was largely white, is because they were looking for a way to make anti-poverty programs more popular in the United States. And the urban poverty was so much focused upon African Americans, and there was such a resentment throughout the South, particularly about African Americans still, that our leaders looked to Appalachia and the poor white families there, and so the poverty became a universal problem, not just a problem associated with minority groups. And more than 40 million people, that was, and over a third of them children, and I can't imagine it wasn't more than a third of them children, lived lives that were really passed over by modern economics. And so when Lyndon Johnson became president, he declared what he called a war on poverty, and that was in January of 1964, in fact, and a number of programs were put in place that were intended to really were focused very much upon training, education, and jobs. And so much of our social welfare programs, the focus is placed upon putting people to work. And there's an inherent issue with that, because our economic system requires a 5% unemployment rate to function properly. That means that out of 20 people who are actively seeking work, now remember, these are people actively seeking work. These are not people who don't want to work. These are not people who are disabled. These are not children. These are adults actively seeking work. 1 out of every 20 cannot have a job if the system is going to work right. And that's because it has to do with how wages interact with people who want the ready workforce and all of those kinds of things. And so the long and the short of this is that we have an economic system. The success of our economic system is built upon the backs of individuals who are unemployed in some respects. And so why should we resent providing assistance to those individuals if the economic system relies upon a certain amount of unemployment? And so in any event, we continue to focus our social welfare interventions, so many of these programs, upon jobs and work, when it's inevitable that a large portion of the population will not have a job, will not be able to get work. And so this could be one of the reasons why we have an issue with poverty and why we can't seem to overcome poverty. One of those things that as a society and a culture and a profession, we need to look at our values about work and people who don't work, and what we say to ourselves and to others about them. That's going to be a theme you'll probably hear from me out throughout the semester. After the war on poverty, there's a lot of other problems that happened in the 1960s. The series of assassinations of both Robert and John Kennedy and Martin Luther King, Malcolm X, civil rights leaders, as well as leaders, in the Washington establishment, were assassinated. The war in Vietnam escalated. The hippie movement was blossoming in its fullest, and there were protests frequently. And in the inner cities, many of the poor in the inner cities became very frustrated, and the cities exploded, and there was riots in the cities. And so by 1968, I think the culture, the population of the United States had tired of the change and the pressures, the social pressures. And after Lyndon Johnson left office, voted Richard Nixon in to the presidency in 1968 on a strong law and order platform. Hubert Humphrey, his opponent, the Democratic opponent, was a strong social welfare proponent and also a peace candidate who wanted to get out of Vietnam, but nonetheless Nixon was elected, and so we began an era of more conservative social politics when, at least out of the White House, with Nixon's election. And actually, if you look at Nixon in the light of some of our politicians since, including the Bushes and Reagan, Nixon really was still pretty liberal himself in his thinking, but so there was a backlash against the social welfare programs, the growth of welfare through the AFDC program and the various programs that were implemented during the war on poverty. And so, while there were some other programs such as the Comprehensive Employment and Trading Act, or CETA, implemented, the idea, by the way, CETA was an interesting program. The government would fund a position for somebody who was out of work and would actually pay the salary of a person, and that person could work in a business, and the government paid their salary for a year, so there was no cost to the employer for that person to work there, and that person got job skills. And that was a very good program, I think, But and the idea would be that by the time that that year was up, the employee would have become valuable to the business that they were where they were working, and that they would take a regular paid position with the agent, with the business or agency they were working with. Great concept. Unfortunately, it was defunded eventually, but. So there were a lot of social policy changes and accomplishments, some amendments to the Social Security Act. There was some improvements as far as Social Security Act, so that basically aid to the disabled and low-income elderly, those who did not work long enough to actually get Social Security benefits. Those programs were administered by the states, and the Nixon administration federalized those programs so that there was a consistent amount of payment for those individuals across the nation. And this is the program we now know as the Supplemental Security Income, or SSI program. Government intervention continues to be unpopular through the mid-70s, and in 1980 Ronald Reagan is elected president on a program that's wanted to reduce government intervention, and among other things, one of the things that Reagan did was take the federal controls of a lot of the poverty programs out of federal control, and just essentially to give the states block grants, they were called, just an amount of money, and say, here, you administer your own programs. And there were a lot less restrictions on how that money was spent by the federal government, or less federal restrictions about how that money was spent by the state governments. And so some of the consistency in terms of benefits and assistance to needy individuals was lost through this block grant. It was really kind of a dark period, the 80s, for social welfare and social workers in many respects. The number of poor was back on the rise again, and there were a lot of serious problems with drugs developing. Nancy Reagan's famous solution to the drug problem was her Just Say No campaign. Again, individual blame, individual responsibility. Really don't look for the government to do anything. Don't look for programs to help you take care of it yourself. Domestic violence, homelessness comes up. The AIDS epidemic first emerged during the Reagan administration, and I have been told and have read that, in fact, in the 8 years of his administration, Ronald Reagan never once uttered the term AIDS, even though it was it had really emerged during his administration. After an interlude where George Bush Sr. spent 4 years in the White House, Bill Clinton was elected, and the Clintons were to the left of the political spectrum at the time that they were elected, but within 2 years there was quite a backlash, because one of the things that the Clintons tried to implement, interestingly, in the early 1900s was universal health care. They were actually Hillary Clinton headed this effort, and their objective was to establish a single payer health insurance, that is basically a government paid or government run system of healthcare that would assure healthcare for all individuals. Now that's the key there is very important. But in this capitalist system, the idea of government being the sole source and being the in control scares a lot of people, unfortunately, because this is the system that almost all industrialized nations have all around the world, and it works fine. And yes, you hear all these stories about long waits and poor quality health. I think if you look at the statistics in terms of life expectancies and what do you call infant mortality and things like this, the United States is in terrible places. Despite all of the wealth that we have, we're way down the list in terms of life expectancies and infant mortality and other kinds of indicators like that. So whatever these other nations are doing, I don't care if you have to wait longer for it, their individuals are healthier than us. But in any event, the effort to implement universal health care, which incidentally was also proposed in the Social Security Act and was cut out before it got passed in the 1930s. The Clintons' efforts to implement universal health care failed miserably, and once again a bit of a backlash in the midterm elections in 1994, and there was a very conservative reaction, and the Republicans got control of the House, and I think maybe the Senate too. And it became clear to President Clinton that he needed to move more towards the political middle, and he did that. He was a master politician. And one of the things that was promised as his administration continued was to end welfare as we know it. And this related to this notion, let's refer to it in this slide, that we think welfare creates laziness. I mean, there is this belief that's prominent in America. And in fact, it's an attitude that I see and hear repeatedly in discussion boards in my classes and in the classroom when I teach people face to face. And this is something that we really have to be careful about and to understand that while there are some individuals that sap the system, this is not the majority of the individuals who receive benefits. And welfare doesn't make people lazy. There may be lazy people on welfare, but welfare doesn't do it. And welfare can help people rise up. But the political attitude, the social attitudes remain in this very conservative country right now. And so the Welfare Reform Act in 1996, and it has PROWRA is are the acronyms, PROWRA, I believe. Personal responsibility is where it starts. The title, personal responsibility, is the start of that title, and that tells you something about the attitudes of those programs. And so, AFDC, the aid to mothers with children that was established in the Social Security Act in 1935, was replaced with a program called the Temporary Assistance for Needy Families. In Alaska, that's our ATAP program. More about that when we talk about poverty later in the semester. George Bush the Jr., that is, George W. Bush, campaigns and is elected, well, not only on this, but he campaigned on the notion of compassionate conservatism. But as you see here, there were a lot of problems during his administration in terms of social welfare. Medicare reimbursements were cut, and so it's become increasingly harder for the elderly, who Medicare covers, to find physicians who will treat them. And while Medicaid Part D provides low-cost medication to the poor elderly, there are also a lot of problems with what's called the donut hole, and that's something I think we'll touch on later on. But there's a certain amount that the government will pay for through Medicare, and then there's a large span until the government picks up again with what's called catastrophic needs that the individual elderly continue to have to pay for themselves. The Obama administration is trying to close that donut hole, and the Affordable Care Act, I think, eventually will do that. But this is, again, another thing that has been a factor for individuals. The elderly in particular seem to have suffered a great deal in the Bush years. And a lot of this is because, we went to war overseas. He cut taxes, sent us into 2 wars. And right there you can begin to understand how it is that our economy had the problems it had before his administration was over, cutting taxes and putting us into very expensive wars. The focus was upon homeland security and fighting those wars, and so really interest in social welfare waned greatly during that period of time. I suppose one thing we can be thankful for is that the war distracted him away from his desire to privatize Social Security. Unemployment went up, jobs went down. The economy really was crashing by the time he left office, and Barack Obama in many respects has been picking up the pieces ever since, and continues now because he's in the White House to shoulder the responsibility for the economy and its slow recovery and all those things, and when you consider what he started with, he's probably done a decent job. His administration has done a decent job. But there are progressive social policies in the Obama administration, and some of these are noted here. I will tell you, and of course the most prominent of the signature act, of course, is the Affordable Care Act, or we call it Obamacare, which is not single-payer health insurance, and it still relies upon private industry and the insurance companies in so many respects, and that's one of the things that undermines it, I believe, because the insurance companies are profit motivated. But the Affordable Care Act is changing how reimbursements occur in such a way that it is intended to discourage those kinds of things with the insurance industry and to encourage doctors to improve results. We'll see over time. There still is a significant portion of individuals not covered that still do not have insurance under the Affordable Care Act, and so this is not universal health care by any stretch of the imagination, but it is extending health care to individuals that hadn't had any before. A lot of complaints about the requirement to buy health insurance, that and people resenting the fact that they're being told by the government they have to have health insurance. You may not be sick today. You may go out this afternoon and have an automobile accident and require hundreds of thousands of dollars of medical care. And if you don't have health insurance, those individuals who do have health insurance and go to the hospital are the ones who are going to pay for it, because the hospital will recover those losses by charging their paying patients more money. So in either event, you're going to pay, and you're going to pay more. So again, another long discussion involved in looking at the Affordable Care Act and what it can do for us. But there are a lot of people who have been disappointed with Obama and have felt that he hasn't paid enough attention to programs involving poverty. Early in his second administration, he's begun to look at and talk about income inequalities and raising the minimum wage. But it remains to be seen as to what will happen with that over the years ahead. So that brings you up to date in terms of social welfare and the social work profession right now. I will say other books that I've worked out of express a lot of disappointment with what has happened with the social work profession, as we have in many respects abandoned programs for the poor, the interest in the poor and those causes, and a lot of people that get social work degrees look forward to private practices and providing therapy. And in fact, even outside of a private practice, working in mental health centers and in many of the agencies that you work with in the social work profession will be focused upon individual change, and that's where your pay is. If you're going to work in the profession, you're going to work on individual change, because you don't really get a lot of funding sources that support social workers challenging the system. If you're independently wealthy, or you don't need money, and you want to devote your career to changing the system, you can do that, but you're not going to earn a lot of money doing it. Now, getting into the system, working your way up the system, becoming an administrator, for instance, of the child welfare agency or something like that. And I'm not talking about being a supervisor like I am, but really being an administrator. You can be in a position to implement system change, and so I don't mean to discourage us from going forward with the kinds of jobs we're going to get, but understand that as you are working with individuals and focus upon individual change, we still have a responsibility to advocate for system change as well. So more on that as the semester goes along. That's it for Chapter 2, and I hope that this brief and rapid introduction gives you an idea of where we've come from, and now we'll be looking at where we're headed over the next several weeks.